Welcome to The Explainer. Today, we're going to dive deep inside the heart's most critical arteries. We're talking about a technology that has to do the impossible, take a crystal clear photograph of a target that never ever stops moving. This is the coronary CT angiogram, or CCTA. So let's just start with a really important fact. Coronary artery disease isn't just some major health issue. It is the #1 cause of death and disability on the entire planet. That fact alone makes finding it early and accurately a huge deal. And right away, that presents a massive technical problem. Your heart is always in motion, right? It beats something like 100,000 times every single day. So trying to get a sharp, detailed picture of the tiny little arteries that feed it, well, it's kind of like trying to photograph the wings of a hummingbird in mid-flight. It seems almost impossible. Well, the answer is a truly revolutionary technology. Coronary CT angiography. It's a non-invasive way to get a frankly stunning look inside those constantly moving arteries, and it has completely changed the game for how doctors diagnose heart disease. Now, the real power of this scan, its core strength, lies in something called a high negative predictive value. I know, that sounds super technical, but it's basically a fancy way of saying the test is incredibly good at telling you when everything is perfectly fine. Let me put it this way. If a CCTA scan comes back clean, you can be extremely confident that there are no major blockages. And the power to rule out disease like that? Wow. It's not just about giving someone crucial peace of mind. It helps everyone avoid procedures that are way more invasive, way more risky, and a lot more expensive. But getting that perfectly clear, flawless image isn't as simple as just pushing a button. No, it requires some really careful preparation. It's a whole science that happens way before the scanner even gets turned on. To get that perfect shot, it's really a three-step dance. First, doctors use medications called beta blockers to gently slow the heart down, which reduces any motion blur. Second, they use nitrates, which help widen the arteries just a little bit, making them much easier to see. And finally, the patient gets coached to hold their breath at the perfect moment, which gets rid of any movement from breathing. Okay, so the patient is prepped. But how does the technology itself pull off this magic trick? How does it actually take a still photo of a moving target? The secret is this brilliant technique called ECG gating. You see, the scanner is hooked up to the patient's electrocardiogram, their ECG, and it's programmed only to take pictures during the heart's resting phase, that tiny split-second pause that happens between each beat. You can think of the CT scanner as a super high-speed camera. And that ECG gating? That's the sports photographer's perfect timing, you know? They're capturing that unbelievable action shot with total clarity because they snap the picture at the one precise moment of stillness. All right, so the images are captured, but the work is definitely not over. In fact, you could say it's just beginning. Powerful software now has to take all that raw data and turn it into something a doctor can actually use to make a diagnosis. The whole thing starts with hundreds of these thin, cross-sectional images, which are called axial slices. Each one is just a flat 2D picture looking through the chest. It's a ton of information, but it's not really in a useful format yet for seeing the entire artery. But then, something really cool happens. The software takes all those 2D slices, and it digitally unwraps the winding, three-dimensional coronary artery, and it lays it out in a perfectly straight line. This is what lets doctors look right down the entire length of the vessel to spot any narrowing. And finally, all of these different views get stitched together to create this incredible, interactive 3D map of the patient's coronary anatomy. Doctors can literally spin it around, zoom right in, and check out every single branch in amazing detail. And you know what? The technology is always getting better. Take a look here. On the left, that's a conventional CT. But on the right, that's a newer technology called photon-counting CT. Just look at how much clearer that image is. It's especially useful in tricky situations, like trying to see inside a metal stent, where the older scanners would really struggle. But the power of a CCTA doesn't just stop at the heart. Because the scan captures the whole chest, it gives doctors this really valuable opportunity to look for other potential problems completely by accident. Radiologists are trained to do what's called a systematic extracoronary review. It's basically a careful, top-to-bottom check of everything else in the picture, the lungs, the bones, you name it. It's like an extra layer of safety built right into the test. And this process can lead to some incredible, sometimes life-saving, accidental finds. In this scan, which was done just to check the coronary arteries, the doctor also spotted a huge pulmonary embolus. That's a big, dangerous blood clot in the lung, and it needed immediate treatment. And that checklist is pretty long. This review can uncover anything from early-stage lung nodules to hidden rib fractures or even aortic aneurysms and fluid around the heart. It just adds so much value to the exam. Now, there's often another quick scan done right before the main CT-CTA. It's called a calcium score. This one doesn't use any dye. Instead, it measures the amount of calcified or hardened plaque in the arteries. That hard plaque is a sign of long-term artery disease, so measuring it is a great way to help predict someone's future risk of a heart attack. So at the end of the day, you take all of this amazing data, the 3D maps, the extra coronary review, the calcium score, and it all gets boiled down into a single structured report. It gives doctors a really complete picture of a patient's cardiovascular health, all in one place. And that is really why all of this matters. This technology leads directly to better outcomes for patients. It means we get earlier, more accurate diagnoses. It means we have a much clearer idea of a patient's individual risk. And ultimately, that means more personalized and more effective treatment plans. So to sum it all up, CCTA gives us this fast, safe, and incredibly detailed look at the heart's arteries. It's a genuine game changer in our ability to diagnose and manage the world's #1 killer. And that leaves us with a really fascinating question for the future, doesn't it? As this imaging technology just keeps getting better, faster, clearer, more powerful, what other diseases might we be able to predict and maybe even prevent long before they ever have a chance to cause symptoms?